On behalf of the Wharton student body, I welcome you to this Friday morning session of the 17th Annual Wharton Healthcare Business Conference. The theme for this year's conference is Leadership in an Evolving Global Market. It is our hope that this conference will serve as a dynamic forum to freely exchange ideas, to build personal and professional relationships.
My role at the Cleveland Clinic has really evolved over the last 15 years. Currently, I'm responsible for strategic planning, business planning, as well as being the Chief Information Officer for the organization. Cleveland Clinic's been around since 1921, and it's an institution that has really been known for innovation. It's a unique organization because it truly is a physician group practice. We have practiced collaboratively across all the specialties for over 80 years. So what's at the forefront of our thinking? The first is the idea that we really need to move to a system that's designed to deliver care that maximizes the value for the patients that we serve. So how are we doing that? We've moved through several phases. So the first is we did administrative integration. We garnered some assets, additional hospitals, additional physician group practices, and we reduced the administrative cost for supporting those assets. The next thing that we did was to move to a phase that we call clinical integration, and that's where we've applied technology so that we can gather all of the information we need to best care for a patient by getting it into information technology and being able to distribute it at a moment's notice to the next clinician who's going to see that patient so that they can make good decisions. The third phase is now what we're calling operational integration. And it's the idea that there is an optimum care path that should be coordinated for taking care of patients with acute problems. The big three advances that I see in medicine are, first, being able to be explicit about the value that we bring to patients, and to do that in a relatively scientific way so that all practitioners clearly can understand it and that it's consumable by the average patient as well, so they know what a good score is. The second is to use this technology to allow us to redesign the care process so that it occurs in the optimum location rather than the location that might be most convenient for a particular provider. And the third is to be able to demonstrate that we can improve the value or quality of care while managing or reducing cost over time. Because being more cost effective with our healthcare dollars is an absolute requirement as 77 million baby boomers go from being 35 to 55 to being 55 to 75.